national and international journals of high repute. Our expertise is utilized by the State Planning Commission to chart important issues like prevention of malnutrition, etc. Besides being a life member of professional bodies, ma'am has been an invited speaker at many regional, state, and national levels. Her messages reach out to people through the programs in the media too. This me as an individual is very humble and helpful person with lots of patience. Ma'am, we wish you greater heights and achieving success in all your endeavors. Thank you once again for accepting our invitation to speak on nutritional challenges of special children. May I invite Dr. Hemamalini to take over. Thank you, ma'am.
Good afternoon to all of you. Thank you very much, ma'am. Bhavani, ma'am, it's my pleasure. And in front of the great teachers like you and Sharifa, ma'am, I'm humbled and honored to be the speaker for today. As the country as it's celebrating the World Breastfeeding Week, I'm also glad to be a part of the week's celebration through this webinar. I thank Sharifa, ma'am, once again for inviting me to be the speaker for today. I hope I'm audible, ma'am. Is it clear, ma'am?
Yes, ma'am. Yes, ma'am.
Thank you. And I could see almost all the participants. Many names are very familiar. I thank all of them to have logged in and waiting to have an interactive session. And it's also my pleasure, and I hope I do justice to the topic that has been assigned to me. With this few words, I jump to the topic. I'm just presenting, just a second. Yeah, so when we were discussing, there is going to be a lot of buzz around breastfeeding, and I also see in the invite tomorrow two eminent speaker also are addressing the topic on breastfeeding. So it was discussed that we will talk a little bit on the nutrition challenges of special children, because I hear exactly I may not be focusing on breastfeeding, but I feel this may be of use to us to handle, especially the students over there, to know to handle the special children, so especially disabled. Thanks once again for the opportunity. For the next few minutes, we will have this interaction. As again, we all know, we define the special syndrome. It's a broad spectrum of diagnosis, starting with autism spectrum and Down syndrome, cerebral palsy, and also attention deficit, and it list goes on. So I will be just touching upon few of them where we get to handle them in our hospital with little bit of personal experience, what I have gathered from the people who handle them also. I had made the slides and also combined it with the theoretical aspects. So the first slide, without starting for the objectives and other things, I jump out to the topic. The first slide basically talks to all of us about the different problems that are faced with these children, those with cerebral palsy, those with Down syndrome, and other specially disabled condition. So we could look at most of them are listed here. So we need to understand this first before we get into the nutritional aspects. So we could see more of underweight, overweight, short stature, that is stunting. And when it comes to the feeding problems per se, there is a lot of oral motor problems, inability to self-feed, and swallowing incoordination. That is a major problem with most of these kids, wherein the caretaker and also the healthcare professionals will find it very challenging. There is some disturbance, ma'am, the audio disturbance. May I request everybody to
Hema,
mute?
there's something with the disturbing, maybe the fan or disturbance,
Okay, ma'am. I'll switch off the fan, but other than that, there is nothing here which is disturbing.
Other than that,
I could hear that.
because maybe you can louder or come closer to the mic.
Yeah. Is it clear?
Yes.
Is it clear?
Better,
Audible
now
now?
Yeah, now better. Better, Hema.
Yeah. Okay, ma'am. Okay. Yeah. All right. Thank you. So we were talking about the different challenges still I do get the oral motor problems, inability to self-feed, that is what we were talking about, and weak suck in infancy, especially when we are looking at the breastfeeding capacity, there is inability to sucking difficulty is there and requires a lot of controlled environment to encourage this. In case of autistic children, there is a lot of refusal to eat many foods with texture, very selective in foods, and accept the possible gluten or intolerance. We will talk about that a little later. And then we do have other conditions as cystic fibrosis and spina bifida. One moment. So this is the different types of problems we come across normally in children with special disabilities, especially challenged. I just touch upon each one of them. So autism, they are always unique and they are totally intelligent
Presentation
and
not
very
seen.
persuasive.
Presentation not seen. Presentation
One
not
minute,
seen.
ma'am. Okay, I'll come back. I'll just show again because I'm the screen. I'm seeing that. Now it is seen. No? Now is it seen?
Yes, Hema. Thank you. Thank you. Sorry for interrupting.
Oh, thank you. So I just started upon with few of them highlighting on each of the specially disabled condition. The autism, they are always unique and they have a lot of feeding problems such as pica, which is eating of non-food substances, rigid mealtime patterns or limited food repertories because they don't easily accept many of the foods. They have aversion to textures and difficulty adjusting to the changes in the environment. This is what has been also reported by the people who have been taking care in our university. So, how do we handle all of them? In case of pica, normally they like to eat clay, dirt, ice, all this kind of non edible food items. And there should be an interdisciplinary approach. And throughout this lecture, we will be listening to this interdisciplinary approach because only the nutritionist is not going to be able to handle. As nutrition professionals, we will be able to tell how to improve the nutritional intake, what kind of alternatives we will be able to give. But how actually it gets into the child is a bigger question mark. And the real time meal patterns are also very difficult to handle with these children. They have aversion towards a lot of textures. They may only want foods of a specific texture, such as liquids or soft texture. And school lunch environment is another challenging, which they will be the even the teacher over there will not be able to really look at it. Here there is a information on gluten and casein free diet. However, it is actually not completely proven with the appropriate randomized control trials whether these two really help them in avoiding or in including. So it has to be dealt individually with the different symptoms that they may be exhibiting, rather than in general talking to them about gluten or casein-free diet. As far as lactose-free is concerned, it may milk and milk products are the only natural sources, and we should be able to incorporate other ingredients, and it can alleviate GI symptoms if the child is lactose intolerant. Again, even here we have to do detailed assessment of the child so that we will be able to understand whether this child is really intolerant to lactose. So that is about a quick view of the autistic child. Cerebral palsy is a different ballgame altogether. There is a problem with the growth.
Sorry, again, it's not seen. Your presentation is not seen. Who is Bhargavi Jayam? No, like their screen is visible.
I don't know who is it, Bhargavi Jain, ma'am. Same mode of 1 minute. Yeah, so here I am also looking at
I can
PCNR
see
Bhargavi
only
Jain present.
PCNR Bhargavi Jayam. Who is it?
I don't know, ma'am. As the main presenter, I don't know. Even now, I am getting to see that.
Yeah, we can see only PCNR Bhargavi Jayam.
Now, ma'am? I'm sorry for the inconvenience
Now
which I
I
am
can
not.
see your last slide. Yes, yes.
Which I am also not sure what is happening. Now it is clear. Now is it
Yes,
visible,
yes.
ma'am?
Yes, ma'am.
Yes,
Yes.
yes, yes.
Yeah. So when it comes to these cerebral palsy children, there is a lot of growth faltering. There can be both underweight, overweight, or short stature. Mobility is always a challenge. There is both of the ambulatory and non-ambulatory, and also they need a lot of assistive devices. And dysphagia is a greater problem over there with oropharyngeal esophageal dysphagia. That is where the nutritionist and the speech pathologist get hand in hand. And poor muscle tone also interferes with the child's coordination to hand to mouth, holding the spoons and all. And there is a possibility that we can consider oral, enteral, or parenteral feeding. So there are so many of them has been listed out on the slide for us to look at what are the normal feeding issues of children with cerebral palsy. As nutritionists and caretakers, we should be able to teach them by feeding themselves. That is very, very important. Instead of making them that we feed them all the time, we have to educate the children to feed themselves, and that is what is done in our special school at Ramachandra. And these are the different devices normally told, but there are also certain devices which the parent or from the special school, they will be able to make use of it and encourage the child to self feed. So they, because of their hypotonicity, holding the spoons may be difficult. So if you look at here in this particular picture, there is special equipment, special way of fixing the hand and enabling hand movement and special sitting postures. It's very important. Unless the sitting postures are encouraged, child is not going to find interesting to eat the food. And as you could see, the feature of this, it is very specific to dumping syndrome. The nutritional issues in the dumping syndrome is oral anomalies is there, which disables them from chewing and swallowing, which also is a very big challenge with respect to breastfeeding. And transition to complementary feeding is going to be another issue of concern. Then there are issues with overweight and underweight. So the weight management becomes a very big issue because we have seen children when we are walking in the campus, we would have seen children with Down syndrome who are absolutely obese. That it is very difficult for them to control their weight gain.
Again, the slide is not there. Who is Akila? Emma, again, your slide is not.
I just don't understand what's
We
happening.
cannot see Akila. Who is Akila?
Ma'am, this is Menaka, ma'am. Hema, ma'am.
Yeah, yeah,
Sorry,
yeah.
ma'am. If you again present it, I think the participants while joining, they have sharing the screen.
Uh,
Okay, okay. Kindly again share it again, ma'am.
yeah, yeah, I'm doing that. Yeah,
Thank you, ma'am.
yeah.
It's visible, ma'am. It's visible.
Yes.
Thank you.
So it is a Down syndrome growth chart, which we can use for children to monitor their growth. And these are the different problems with the children with Down syndrome. The feeding issues are related to poor lip seal, protruding tongue, poor musculature, oral motor coordination, and there can be possible nutritional deficiencies. And there is also in coordination with the sucking, swallowing, and breathing. So this is a major problem. So when I was discussing with the caretakers in the special school, what they were telling with respect to the poor lip seal. So I was just informed the caretakers and even the parents are trained to keep the food in the mouth of the child and close and hold the lip. Encourage the child to slowly bite and swallow. This is a very important technique that I could understand from them. Because of paucity of time, I was not able to get the videos or the pictures, but this will help most of the students who are here and aspiring to become nutritionists concentrating on these kind of group of people. It was told like you keep small pieces of the food in the mouth of the child, especially um, the back of the mouth. Make the child to chew and lip close the lip and don't apply too much of pressure, but slightly close the lip so that the child does not open and chew the food. So this has been shared by them. And here we do have the reason for the obesity, which I was mentioning, is mostly because of not because of overeating, but very much because of the reduced energy expenditure and reduced physical activity. So we will have to encourage good amount of physical activity in these kind of children, and they are more intelligent. Actually, we have observed that these kids are very intelligent and they have multi-talented. So it is most of the schools who have joined for this webinar also, I'm sure, would have been identifying their talents and engaging them in that particular way. So that is going to be the most important way forward to avoid them gaining more weight. So the nutrition management principle would be give a observe like or a monitored weight gain. That is important, and prevent weight loss.
Hema. 1 second,
Yeah.
Hema. All the participants kindly switch off your video and audio. Participants, please switch off your video. Thank you. Because your slide was not seen. You can start now, Hema. Suddenly your slide disappeared.
I don't know. I think the people, this is something very new experience now because we have been doing this webinar without major issues. I don't understand what's the problem. Anyway, now is the slide is seen, ma'am?
Yes, ma'am. Yes, ma'am.
Yeah. So there is reduced physical activity and weight monitoring and how to advise the child without gaining lot of weight, but still gain the weight appropriate for age is going to be the focus that we need to look at while giving the nutrition counseling. So it is said that we have to set weekly goals, one goal for one food related behavior and one for activities. This is what the parents have to be taught, that suppose I want to make the child to eat one small piece of fruit, maybe say sapota. So probably for that week, that is only goal. So I encourage the child and also the parent to focus on this particular food related behavior and make the child to get familiar with this food and eat properly. Similarly, one activity, it can be anything that the parents and the child choose to be, that can be focused. So over the time, the child and the mother will be able to specialize or to get used to the eating behavior and also the physical activity, and set daily goals that lead to the weekly goal. Create a way to keep track of success, and visual methods of record keeping are very, very successful. So this is also what we encourage to the parents, visual methods of record keeping. So it will be easy for us when they come back and show it to us. It will be easy for us to say, to correct them where they were going wrong and to have an interaction and help them to go forward. And these ADHD children are a very big challenge, because in the campus also I do see whenever we cross this particular school, because luckily our floor is on top, that is we are in the third floor, our department is in the third floor, and the special school is in the second floor. So when we are passing from the ground floor to the third floor, we will be able to see these kind of children. One way it is they are totally engaged into a lot of activities. The teachers are helping them in their eating and drawing skills, and even poem reciting. A lot of activities will be around. Also, I could see many of them during their lunchtime, the way they are made to sit, the special tables and chairs that they have, and how they are actually training the parents to be very patient with the children and feed them. So there are a lot of experience around there. This ADHD children, they keep moving around a lot, as you know, attention deficit hyperactivity disorder. So they keep moving around. So it is very difficult for them to focus on what they have to be eaten. But what I wanted to highlight here is that there is no specific recommendation for children with ADHD. It is only that we need to make them to sit in a position, sit in a place, and then try to enjoy the foods. So what was told is over the discussion, these kids, you can just create an atmosphere where they like the environment around them. They get focused around in that particular environment, and make them to eat. At the same time, also don't offer, like like if the child wants to be more restless and keep moving out, the mother have to be gently, at the same time strictly telling the child not to move on. You will be going to play only after you finish your meals. So these kind of really behavior related training is very, very important for the mother also to impart to the child. Whereas nutrition component, it is not different. It is only that the Academy of Nutrition and Dietetics, it focuses on a very healthy, balanced diet, reduced intake of simple and carbohydrates and sugars, but increase the complex carbohydrates, whole grain foods, engaging the child in planning and cooking, and exploration of new foods should also be encouraged. Because as we were seeing in the beginning of the slides, many people are fussy and they identify only few foods closely related to them and they just want to try that alone. But here it is that we need to encourage the new foods so that they get familiar over the time. They get familiar to multiple foods that we have to feed them. So this is what is the recommendation by the Academy of Nutrition and Dietetics also. In the next few slides, I am just going to present whatever we have observed in a group of subjects that we were working on at a particular point of time. So if you could see here, there were 40 boys and 35 girls, and we could see between 5 to 7 years of age, wherein this particular data from this group shows that they are not much deviated from the normal children. So this is what we have done a few years ago, and we could see these two are the major problems here. Underweight, wherein we could see 13% of the boys and 5% of the girls were underweight, and 7% and 3% respectively were obese. So other than that, majority of them were falling within the normal percentile, except for some of them in the overweight category. So this is how it goes. And currently, the group of people that we are working, there seems to be this group. The one which I'm presenting is a little different group. The one which we are working currently, our department, is another set of people, wherein we find a lot of stunting now. Though I don't have the figures here, but we could find that there is a lot of stunting in the current group. So this is a challenge for us, that more than the underweight or overweight, stunting also is present. So as a nutritionist, we have to focus on these three categories.
Sorry, Hema, you have to come full screen, Hema. Hema,
1 minute, ma'am, 1 minute.
not full screen. Please make it full screen. Again, it has gone. It has to be full screen. Only then there won't be questions.
Full screen of
Menaka, you please instruct her, Menaka.
Ma'am, Hema ma'am, it's a kind request. Ma'am, don't share your screen, ma'am. Just share the file, ma'am. PPT file alone.
that is what I'm doing,
But
Menaka.
together with your screen, it's getting displayed, ma'am.
1 minute.
Share window, ma'am.
Yeah, that is what I'm doing. Sharing the window, a window wherein I have the Microsoft PowerPoint, and that is what I'm sharing.
Okay, ma'am. The right hand side, the participants video view also we could see, ma'am. Even if you put the full display, na kuda apdi dhaan ma'am vandirukku.
1 minute.
You are able to see that view, ma'am?
And now it's okay.
Okay.
I am not seeing. I am seeing my full screen only.
It's gone.
I
Now we are not able to see.
Now, yes, ma'am. Yes, ma'am. You are presenting.
Yes, yes, yes. It's okay.
Kindly close the left hand side of the grid box, ma'am. The participants, ma'am. Kindly close it.
No, because I am not seeing that on my screen.
Okay, ma'am. You're able to see the PPT alone, ma'am?
Yeah. In my screen, I am seeing only the PPT.
Okay. Again, the slide has closed, ma'am. You have to share it again, ma'am.
Now?
Yeah. Yes, ma'am. Yes, ma'am. Kindly proceed,
Yes.
ma'am. Sorry for troubling you. Thank you, ma'am.
Okay, so this is what we have observed, and this is another comparison that we did on the different diagnostic children, ASD, ADHD, and so on. Again, among these kids, there were not major difference between the anthropometric parameters. There is no significant deviation among the children. So we cannot say that whether ASD fares well or children with ADHD fares well and so on. This particular slide shows most of them are able to, with guided intervention, they're able to reach their growth profile, and there is no specific case-based deviations among the different categories. And this is just an overcap of what we have been observing when we handle the children there. So the children can consume only liquid foods due to swallowing difficulties. This is what repeatedly we see. They are picky eaters, leading to deficit in overall nutritional need of that particular age, lack of proper meal timings, and they prefer, as like any other children, they do prefer junk foods and fizzy drinks, and a lot of the same aversion or avoidance towards fruits and vegetables and pulses, and they have intense negative face reaction. This is something interesting to observe, and we can even correct them when they are really in our hands as a team. So intensive negative face reactions were shown by the children on seeing foods they do not like. This is what we have observed when we are actually handling the children. And there are also interest with the color, taste, and texture changes, which has an effect in the consumption of the foods. So this is what, as a team, we focus. When I say the team, it is not only the nutritionist. There are also speech pathologists over there, and the people, the occupational therapists, and actually the people who handle the school, the special school faculty. They're all there. So all of us will have to be interacting, and we give them the suggestions for change in the texture and taste and color of the food, which has really affected and improved their intake, overall intake. And this is another problem we do have: hold food and bite, sip and drink. It's also always a problem. Spillovers of whatever they are eating, likes and dislikes, balancing issues. Balancing, I just showed in the picture also, the balancing issue of sitting postures and holding the spoons, holding the tumblers, holding the plate, all this, holding the food and biting them. All this becomes a very big issue for this kid. So it is only based on repeated sessions of counseling, repeated sessions of demonstration, and little bit arrangements of their seating postures, and also the arrangements of the different food items. With all this only we are able to improve. And this here I would want to stress, though from the medical nutrition therapy point of view, there are very many guidelines, and there are very many instructions that are given from the theoretical point of view. So for us, there is I would like to stress, there is not major special diets for these kids, because if we start avoiding or making special diets for these kids, it is definitely going to end up in nutritional deficiencies. So it is, from our technical point of view, we know the nutritional requirements, and we do know the alternatives that we can suggest. So all we have to focus is to handle these specific feeding challenges of the children. So how to hold the food and bite. That is where I told the caretakers, they're taught to keep the food well in the mouth and allow the child to chew by closing their lips, pressing and closing their lips. The sip and drink also. So whenever the child is not able to sip and drink, again, there are specific kind designed tumblers, or even with just regular spoons and tumblers that your mother is taught. And during the meal timings, the spillovers are really given significance. That is, all of them sit together, and and there is a overall supervised eating pattern that has been developed over there, wherein the child is taught the table manners, how to eat without spilling, and how to complete the food that has been served and all. And for this, lot of exercise is done by the faculty and also the parents to plan the menu. What food to be brought the next day for the lunch, what snack to be brought. All these are planned ahead, and it is really, as a coordinated issue, is being taken care. And so that's how it is taken care. Initially, small amount to taste. So we will be, as a nutritionist, and we will be as caretakers, we will be excited or over enthusiastic to say that the child should finish all the food that is being served to the child. But actually, it is going to be a challenge. We won't be able to achieve that. So initially, small amount of the food to taste. So I was giving an example of the sapota, the chico. So if I want a child to eat the chiku, it is not the entire fruit I should give. So they have to get the familiarity of the food, and it is irrespective of whether the child is a um, ADHD or whether the child is a ASD child or anybody for that matter. The same principles holds true. So you initiate small amount of the food and it is being given to taste to the child. The child gets familiarized with the taste, and while we are giving this, even the presentation matters a lot. So even for me to attract the ADHD child, I should change the shape of the particular food or the color of the particular food, so the child will get attracted. So that is how we will be able to inculcate eating patterns or the choosing patterns among the child. The next important thing is the spoon, the holding. We were talking about the holding and eating. So it is better to give a porcelain spoon rather than a stainless steel or any other spoon, because of safety is one. The second thing is, if the stainless steel spoons are a little sharper, it is going to hurt the child. The child is going to refuse the food totally. So it is important that they and it has been reiterated also in that special school, that we use a porcelain spoon and encourage the child to hold and slowly bite and eat, and help the child to hold the spoon with the support, and definitely the sitting posture. So there are special chairs which is available. Even otherwise, at household level, the mothers are really trained to may help the child to sit and feed themselves. So the texture and consistency modification, and also the adaptive equipment, feeding smaller portions, are all the tips that we should be following, and we should be educating the caretakers in handling these children with the special needs. And there are also a lot of problem with the aspirations. That is another big concern when it comes to cerebral palsy children. So even those things we have to overcome by making the consistency modification, like what we could see by on the screen, like how we can improve with from instead of the liquid consistency, we can make it this little deep pureed consistency, and try to feed the child in smaller quantities. So the variety is also very important. Food selectivity, then there will be more energy dense food should be given, and we should avoid decreased intake of minerals and vitamins from the diet. And these are the major micronutrients of concern when it comes to our dietary assessment of these kids also. Because they have a lot of choosiness and they have a lot of food preferences, what happens is we are able to meet the energy largely, but there is a lot deficit in the protein and good quality proteins, and there is also deficit in all these multiple micronutrients. So this is, we have to focus as nutritionists, the foods which are, because many of the mothers are more this thing, if it is calcium they think only the curd or the milk to be given. But as nutritionists, we will know what are the other alternative sources of calcium, which can be made in the different textures. Okay, that is where we have to focus. This is more for the students and as people who are there, that you need to be more creative in telling the people how you can alternate the source of calcium and make it more palatable, attractive, and also easily consumable by the particular child. And there is a lot of iron deficiency we have noted. Zinc deficiency is also a concern, because again we know zinc, when it comes to zinc, the growth, it is more related with the growth also. So as we could see in the theoretical aspect, practically we did not observe so much of at least in the group that I showed, but we do have children with stunting in the current group that we are working with. So zinc plays a role in appropriate growth profile. It is also important that we need to emphasize on zinc rich foods. And there are other the fat soluble vitamins, vitamin A, D, and E, and including the water soluble vitamins. So these are all the concerns. This is where we found, because though otherwise, if you are able to improve the texture and all, we are able to get into their the habit, make them to eat small quantities. All that is possible, but to meet the nutritional requirements has been consistently a challenge. So here I'm just giving focusing little bit on theoretical aspect, on what basis we can do the dietary counseling for these kids, and the ICMR recommendation comes into help for us, wherein we follow the RDA. So again, I'm reiterating, there is no different RDAs, or there is no different recommendations for handling these kind of kids. We just largely depend on the ICMR recommendation and achieve these nutrients, whatever has been recommended with respect to all the macro and micronutrients. So this, most of us, all of us should be familiar with and continue to put it into practice, instead of giving, because the parents always think there is some magical food which can be given, or a pill that can be given. That's how they look at it. Okay, it requires a lot of patience, a lot of creativity, and also a lot of perseverance for us to continue to educate these parents and tell them what is the reality and how is that we will be able to meet the nutritional requirements, prevent deficiencies, and yet make the child to enjoy the food. So this is another my favorite one, which gives us the portion sizes, and all of us must be familiar with this ICMR 2010 recommendation, the portion size. So when I look at this, so at least we can say, yeah, in a day a particular child should eat at least one serving, that is 100 gram of the green leafy vegetable. So this is how we also encourage the parents. At least the cereals and pulses, mostly they will give. They will focus on idli, dosa, whatever that they can make at home, the puri, chapatis, everything is there. But what about the micronutrients? Unless we include these vegetables and other fruit varieties, it is not going to be easy for us to take care of the micronutrient deficiencies. So we as nutritionists should be familiar with these recommendations, and help the parents to choose from the foods available. Also encourage the child in with the practical tips that I was just sharing, to meet these recommendations, and that is what is important. So at least we can say roots and tubers. Everybody thinks about only potato, always it is only potato, but why should that we not consider about other roots and tubers? No, it is children are more fond of these potatoes, but again here the education matters a lot, that we encourage them to use variety, the diversity of foods that we do have. Even in this current pandemic period, I don't think it is so much of a difficulty for us to get the different foods. So the parents should be encouraged, and this is just an educative information for the students who are there as audience mostly. So there is grains and carbs. We know it gives the most amount of calories and carbohydrates, and good amount of soluble and insoluble fiber, and a whole lot of the micronutrients. Pulses, multiple pulses are there. Also the fat, which gives us, it's an omega-3 fatty acid, the essential fatty acids, and the multivitamins and minerals, with the whole use of fruits and vegetables. And when it comes to the fluid needs, the same thing applies whether it is for a normal child or for this children with special needs. The challenge here is to make them to drink the water. It is difficult for even a normal child to be accepting water, because very many times when we do the counseling, the parents will say "Thanni kudika matengra." I hope everybody can understand Tamil there. So they will say the child will not like to drink plain water. There's always a challenge for the mother. So what happens is, some of the parents, they really encourage the child and get set example. That is also another very important component of handling, whether it is a normal child or these kind of special children. Set example. So that means we have to sit in front of them and eat what they are eating, or make them to eat what we are eating. So it is very important that family sits together, and that is more going to be educative to these special children also. So when it comes to the water, you could see that how we calculate the fluid requirement. For every first 10 kgs, 100 ml per kg, and it goes on more than 20 kgs, it is 1500 ml plus 20 ml for each kg. So this gives us a theoretical aspect of how do we calculate the fluid, but how do we distribute the fluid between the water and other fluid intake, because it includes the milk or curd that they may be taking, and also the regular plain water, soups, and juices. So that is something which we have to focus on and do educate the children, because many times water is not given importance, the due importance it deserves. So it is nutritionists should focus on encouraging and giving different options of water, but of course the pattern of feeding, that is important, because if they don't, we are not in a position to take the consistency of the water, as you know, because they have a sipping difficulty. We should be able to modify it, maybe thin liquids with kind of or a little bit mm, flowy liquids will be able to be given to the child. So this is regarding the fruits and vegetables, and as just quick few more slides on different food options which we can consider and which we can tell the parents to incorporate into the regular diet. I just focused on few nutrients wherein iron, where the requirement ranges between 9 to 28 milligrams per day for the kids. So there are multiple options here. It is a question of how we are going to give these foods. Whether I give it as a puree, whether I give it as small chopped food items, whether I incorporate into any of the batters or doughs, all that is what the creativity that we need to inculcate into the parents based on the child's feeding abilities. So the first thing is to look at the child's feeding ability. That is where the speech pathologist comes in, which consistency the child is able to be swallowing. Okay, that is where the close coordination comes in. So the speech pathologist will be able to tell the nutritionist and also the parent which is the consistency safer to be given. So there's a lot of interactive or integrated work that is there, because this when the speech pathologist gives us the consistency, whether the child is able to take the thick nectar consistency or the semi-solid, or whether it is a simple liquids, it is for the nutritionist to convert these food items that we are seeing on the screen, for example, into that particular consistency. So we need to make it as a green leafy puree, or simply a milkshake with little better consistency, or whether I make it as a dry chips out of the food that we are seeing. All that is what we need to look at. Therefore, we will be able to give the nutrient dense recommendations to the mother. So there is a coordination of the speech pathologist also, area which is not actually, when we were studying also, it is area is not something which has been exposed, right? We didn't, there are a lot of limited exposures that we had. But when you really get into the profession and when you really work with this kind of multi-disciplinary team approach, then you understand what is the role that they play, and how they can how the nutritionist and the speech pathologist can complement each other and improving the nutritional intake of the children. And this is zinc requirement. Most of us know the sources, but the question is, how do I incorporate into the child? So that's where I was telling consistency modification to suit the child's ability to swallow and eat. And these are some of the pictures on calcium rich foods, because these are the challenges, the micronutrients that we observe to be deficit in these kids. So whether we make it as a milkshake or just powdered nuts, or whether it is a thin cut fruits, mashed potatoes, or pureed potatoes, all this is what we will be encouraging the children. And there are also some more consistency wherein we can try looking at. This also is applicable to initiating. It's similar to what we initiate in the complementary feeding option. So the same thing we can be able to try with the special children also. And there are multiple snack options available, because when we look at these special children, especially in a place where we are looking at, there are also snack timings. So it is insisted for the children by the faculty in the special school. They are always given very healthy snack options only. As we again know, these kids are no different from the other kids. So they are also more fond of and chocolates and biscuits and all those kind of non-nutritious snacks. But again, it may not be difficult for the team to inculcate developing interest and also developing a liking to these different snacks that we see on the screen. So it should be possible, and it is possible. It has been possible in our setup also to inculcate the intake of these kind of snacks. So how is it made possible? It is made possible by making the attractive options with respect to texture or color or shape changes to attract the child, whether it is ADHD or whether it is autistic child, whoever it is. That is one. And the second thing is with respect to eating together. Okay, that they as a team they eat, and the same thing has been explained that they do follow it at home also. It is very important eating together. So setting examples, the family members, because again we know the children are great mimics, so they mimic whatever is being done. Normal children, it may be a little easy for us to pick up, but with respect to the specially disabled or specially challenged ones, they also pick up, but the challenge is with on us, where we have to set up a example and make them to observe. That's where the challenge comes. Make them to observe and adapt what is being told. But it is not difficult to bring in these dietary patterns and options into the menu of the children. That is why I wanted to emphasize here. So as a team approach, as educating the parents, being more patient, because it's not going to be very easy. We will not be expecting the results within a day or two or even a week. It may take months together also. So the patients from the professionals, the nutritionists across, the budding nutritionists across, it should be definitely there so that we will be able to achieve, and optimism, because we should not give up our optimism. Nobody is going to listen to the nutritionist day one and day two. They say, wow, the nutritionist has told, let me follow. Nobody is going to do that. So it is more of optimism that we need, and a lot of perseverance that we need to practice for us to be more successful in our journey. So the diet prescription of ours should be to balance the nutrient intake, more emphasis on micro and macronutrients, and we should be able to give different options, and that is where we have to develop our creativity to give whether it is chopped foods or pureed or blended or thickened, anything. Whenever we are studying in our cookery, the lab, the quantity cookery, or even the dietetics, that is what is taught to us, and that is what we need to remember, recollect, and apply. Because we think it is all assorted. No, sometimes we think that we are having a practical and we just go there, we do the cooking and we get back. Actually, it is not the thing as simple as that. That is where we have to learn to be more creative, and that is what we need to practice. Because as a nutritionist, I always tell, whenever I give a very creative, a different suggestion to the parents, they say, wow, ma'am, this is good, I will be able to follow this. That is the creativity should also there be, and also the spontaneity. It is not something I tell all my students all the time. You encounter a patient now, and you cannot tell the patient, நாளைக்கு வந்து நான் சொல்றேன். I understand your problem, but I will.
தமிழ் தானே?
Yeah, everybody can understand Tamil, no?
என்ன அப்படின்னா என்னங்க? Everybody.
Yes, ma'am. Yes, ma'am.
I am also
Yes, ma'am.
repeating.
No,
I am also
no,
repeating
ma'am.
in English.
No, ma'am. No, ma'am.
I'm also repeating in
ma'am.
English. So I am just telling that if I encounter a patient, a client, assess the nutritional status. I understand the nutritional concerns, and I tell, okay, Mr. So and so, you please wait. Tomorrow I'll come and talk to you about the nutritional management. We cannot be like that. So as nutrition practitioners, we should be more spontaneous, more creative. That is what we need to train ourselves for, so that the clients, whether it is, and more so with the children, more so with the parents. Okay, very, very, very important when we are counseling the parents. Sometimes they will come to us after trying a lot of methods. They would have said, no, I have done this, I have done this, I have tried this. Like,
The slide has disappeared.
hello? Yeah, ma'am?
The slide has disappeared.
I don't understand what is. Yeah, I'll get back to that. Just a second. I too don't. It is a new situation for me. Yeah, I hope it is now visible. Is it visible, ma'am?
Yes. Thank you. Thank you.
Yeah. I'm sorry, this is a new situation. I too don't understand what technical issue is happening. I'm sorry for that. And so I was talking about the nutrition is how we should develop ourselves or shape ourselves. In a sense, the patience I was talking about, and also more creativity and spontaneity is something which we need to develop. No theoretical textbook is going to tell us. It is our own individual variation, and we have to live in that moment. When I'm seeing a client with, and that's what I said, very important when I'm seeing a child, a pediatric, and most important when I'm seeing a specially disabled child and the respective parents. So I have to live in that moment, understand what they are facing as a problem, where the child is going wrong or where the parents are going wrong, and then try to counsel and give them the different options. And that is where our creativity comes. So this is important. And theoretically, we are looking at the special utensils for self-feeding also is very important for these kind of special children. And most of them are available in the markets. We will be able to get it, and very many special schools would have already had it in their place. But at home, with whatever is available with these parents, we should be able to make them to come up with indigenous ideas, and therefore they will be able to handle the situation. So correct positioning is important, which will help the child's chewing and swallowing ability. And this is another one. This is, I think, my last slide. This is another one wherein this is also involved or included into the therapeutic aspect of these special children. Okay, it is not only the nutrition, only the nutritionist or only the menu planning when counseling is not going to be helpful. So there is a lot of other activities which will also enhance the eating abilities is incorporated into the regular day-to-day basis of the schools. So there is a lot of fun and variety. Social component, they all have a social get together. We also had a sports day where our department was totally involved in a sports day competition, a sports day celebration for these kids. So that's a social component there. And there are also other rewards that they are given, so they do understand, these kids do understand if they are rewarded and if they are really appreciated and all. So that is very important, that we need to inculcate this, and an exposure to the family and friends also is important. And last one is on a medical medications, because some of these kids may be on different medications also. But as a nutritionist, we need to look at the different medications, if at all they are being given, and how to avoid the drug nutrient interactions, and also how to what kind of feed to be given following what kind of medication. So those kind of things also. So if they are in a multi-pharmacy, we should be able to address that issue also. So I feel that is the last one. Eat a variety of foods and fruits and vegetables. That is what is the base. Okay, that leads us to the healthy eating index. So here I'm reiterating, there is no special mantra or special diet, special kind of restrictions and all. It is what we are, of course it is individualized, and it is what we observe the individual variations of the child, and then continue to give the different options from the food groups that we have, from based on the RDA that we would have learned. That is what is the basic. So make them to eat different varieties of fruits and vegetables, eat a variety of foods, and definitely we will be able to achieve. And probably that is what we observed when we as a team handling these kids. I could not see much of different percentiles in their anthropometric measurements, though there are some of them who are a little underweight or overweight, which they have to catch up because they are new entrants and they have not been with us and so on. But overall, we were able to preserve the nutritional status of these kids. And I thank for your listening. Also, thank you, madam, for the opportunity. Sorry, because I am also not aware of what is the complicated, what is the technical hitch that is going on. Sorry for the inconvenience in the middle. Thanks for your listening.
Thank you, ma'am. participants, the feedback link is posted in the chat box. Kindly fill in the feedback link to avail your e-certificate. Over to Sharifa, ma'am. Thank you.
Hema, thank you very much. This is not a formal vote of thanks that Mohammed Misha will give later on. Though initially there were some glitches, but in spite of that, it was an excellent talk. I have two questions. That is, one is, you say you have a team to treat them. So, like, do you have a psychologist to counsel the parents also?
Yes, ma'am. Yes, ma'am. We do have a psychologist also. So they do counsel the parents definitely.
Okay. The second question is, when you say gluten intolerance, have you tried giving them organic wheat? Is it gluten? They are intolerant to gluten, or they are intolerant to some fertilizer or pesticide that is added to the wheat?
Yes, ma'am, it's possible, but actually we have not tried giving organic wheat. We just basically, as I was mentioning, not much of restrictions we pose on the gluten or casein. Only that if we keep observing, if at all there is a problem, we give an other alternative of the cereal, but we have not tried this. Maybe we can consider that in our future cases.
Thank you, Hema. Now I hand over the session to Dr. Mohammed Mishra.
Good afternoon, all. Thank you, ma'am, for your excellent presentation. In the chat box, there are two questions. Shall I ask, ma'am?
Yeah, sure, sure, please.
This first question is from Amudavalli Satish Pandian. She is asking, is porcelain spoon good to use as it is fragile?
Yeah, that's what. With the support, with the people who have to help them out, the parents or somebody, it is difficult. Otherwise, it is difficult. But it is what is recommended. We will not use a stainless steel spoon. Maybe we can try with the wooden spoon if it is kind of comfortable with the child to hold. Otherwise, porcelain, but the parents are there, no, to hold and feed and support the child. Without that supervision, it is not going to be easy.
Okay, ma'am. The next question is from Dolly Gandhi. She is asking how to distribute fluid to water and other fluid options.
Sorry, come again.
How to
Fluid to
distribute
water. Okay. Yeah.
fluid to water.
Okay. No, it is. I'll just probably go back to that slide if need be. We do that normally in our adult patients also. If I were to give around, say, 1,000 ml of fluid, we restrict the amount of milk or whatever goes in. Okay, 1,000 ml. Give more of allowance to water, say around 500 to 600 ml, and distribute the remaining with the other beverages or even from the food that they get. See, they were taking the gravy, they may be taking the soup or any of those things, the buttermilk, any of those things. So we give the portion size, maybe say 50 ml, 75 ml, like that we distribute and give them in the chart. So depending on again the child or the individual, we give how much of free water to be taken. Okay, 500 ml or 600 ml or 1,000 ml, all that we allocate. The remaining fluid, give them with respect to portion sizes or the measuring sizes. So they will be able to relate it with the intake on day-to-day basis. And that is where we wanted the video recorded feedback also. That helps us to further differentiate and further counsel them. Hope I've answered that.
Yes, thank you, ma'am. Dear participants, do you have any more questions?
Like
Shall
in
we
your
end the
experience, do you
Yes,
think
ma'am.
diet has helped ADH, children?
Yes, ma'am. It has, though I don't have the entire data to present. But with close monitoring and giving different options, it has helped and it has kind of significantly reduced their attention deficit behavior also. It has helped.
Thank you.
Thank you.
Sharika, ma'am, shall we end the program?
Nisha?
Yes, ma'am, shall we end?
Yes.
Yes. Good afternoon, all. Now we have come to the end of this lively virtual gathering. Prior to winding it up, on behalf of IFTRC and NSI Chennai chapter, I P. Mohammed Nisha, Assistant Professor, JBAS College for Women, deem it a great honor to propose the vote of thanks on the first day of this webinar, Nutrition for the Newborn and Beyond. First of all, I would like to thank our distinguished speaker, Dr.A.J. Hemamalini, Professor and Head, Department of Clinical Nutrition, Sri Ramachandra Institute of Higher Education and Research, Chennai, for making excellent presentation on nutritional challenges of special children and making this webinar very interesting and meaningful. We are really enlightened with your knowledge and presence, ma'am. Also, I thank you, ma'am, for clearing our doubts and answering our questions. I would like to express our sincere thanks to Dr. Sheshadri, Secretary, IFTRC Chennai, for his initiation and constant support for the conduct of this webinar. I would like to thank the coordinators, Dr. Sherifa Talha and Dr. Bhavani Inala, for making this webinar a great success. I would also like to thank all the core committee members of NSI Chennai chapter and IFTRC for making their moral support and guidance. Finally, our heartfelt thanks to all our active participants for their cooperation. With these warm words and a kind message, we move to the end of today's webinar. Thank you.
Thank you. Thank you, ma'am.
Thank you, Hemamalini. Thank you so much.
Thank you,
Participant, just a reminder, tomorrow we are having our second session at 4:30. Thank you, Hema. Thank you so much.
Thank you, ma'am. It's my pleasure. Thank you very much,
Thank you,
ma'am.
ma'am. Thank you, Hema, ma'am. There are a
Yeah.
lot of appreciations in the chat box also, ma'am, apart from the questions. Thank you, ma'am.
Thank you. Thank you very much.